Bismillah ar-Rahman ar-Rahim. Today we will discuss and lecture about addiction, disease and treatment. I am Dr.محمد Adil الحديدي, Professor of Psychiatry and Head of Addiction Treatment Unit in Mansoura University Hospital. Addiction is, there is a very common word that addiction is everything can be addicted. Everything can be addicted, whether it is good or bad, and it is not matter that the narcotic or alcohol, morphine or idealism is addiction. This was by Dr. Carl Gustav Jung, which is a famous psychologist since 1875. Addiction in generally we have two main definitions. One is general definition, which is devoting oneself to habit, appetite, behavior, but it not excludes the choice and responsibility. On the other hand, there is a specific addiction definition, which is strong physiological and psychological dependence on the drug and other psychoactive substance. Definition of addiction is compliance to certain habit or to certain condition, and so it can be, there is different form of addiction. One form is food addiction, internet addiction, TV addiction, gambling addiction, and sex addiction. So everything can be addictive. In the recent classification, ICD-10 classification, addiction can be either according to substance, and it can be classified to type of addiction, including the following. The first one is acute intoxication. Acute intoxication is a condition occurred when the substance is intaken by larger dose than usually taking. So the person gets marvelous or severe condition and severe manifestation. Harmful use is another form in which the addiction is taken in the condition which is be harmful for him and for society and for the people and sometimes for the family. Dependence, in which the person neglects the importance of social and occupational condition and activity, and he depend on the drug, and this dependence include tolerance and withdrawal symptom. Withdrawal state, in which there is physical and psychological symptoms occur when the person either stopped or reduced the amount of drug he taken. So we have two types of dependence. First type is psychological dependence. Psychological dependence, in which the person, once he stopped the drug, he has psychological symptoms, and these psychological symptoms can affect him and making him to return to take the drug again and again, and so he cannot stop this psychological symptom, like he cannot be socialized with people, he cannot speak easily, he is stressful, and he feels that he is not at ease in everything in his life condition, and so he continue to take the drug. In this psychological dependence, he has no physical symptoms. No physical symptom means that he has no pain, no other manifestation which is physically. This is the difference between psychological dependence and the physical dependence. Physical dependence is a condition in which the person once stops the medication or either reduce the substance he is dependent on, he will start to complain from severe symptoms, and these symptoms including gastrointestinal manifestation, can include pain, can include insomnia, can include any other symptoms like convulsion, and all these are physical symptoms which affect the person himself, and these symptoms prevent him to stop this medication. We have a very concise concept or criteria for addiction or dependence, which is the scientific name for addiction. Dependence, first one is compulsion to take substance, so he cannot stop taking this substance. He is aware of the harm but persists use this substance. He is aware that it is very bad for him, but he continues. He neglect other activity. Tolerance, it means that every time he has to increase the dose of the substance he take, so to get the same effect he want or he desired. Stopping, causing withdrawal symptoms, and addiction is usually is time consuming. So when the person is continue to use the substance, he intend to use the substance for a few minutes, but in fact he uses the substance most of the day, and so it's consumed many times or longer time than what he intended to use. Usually the addiction is out of the control, and so he cannot stop use. Once he start, he cannot stop. He cannot take the decision to stop because of withdrawal symptoms and so on. He persists to he needs that, he wants to stop. He has a wish, but he cannot cut down. This criteria of addiction. In the recent classification of DSM-5, which is Diagnostic and Statistical Manual for Substance Use and Related Disorder by APA, American Psychiatric Association, they found that we have two types or two main category of addiction. First one is substance-induced disorder and substance use disorder. Substance use disorder include dependence, as we described before, and substance-induced disorder, it means that the substance used by himself but itself causing another disorder or causing another condition, which is also a problem for him. It can cause psychotic symptom, it can cause mood disorder, an anxiety disorder, sexual dysfunction, and sleep disorder. But the question is why some people are addict and some people is not addict, although they use the drug even for first time. The answer is the vulnerability. Vulnerability means that some people is vulnerable to be addict and other is not. Why this vulnerability occur? Because we have three main factors for addiction, three main categories for addiction. Psychological factors playing rules for addiction, social factors playing role for addiction, and biological factors.